Well, I am very, very happy to have a wonderful doctor and also a music lover as well. And I've kind of known you more from the music lover side. You've been Chief of Staff of Community Hospital of Long Beach Community Hospital, also Director of the Cardiodiagnostic Department at the Community Hospital of Long Beach, and you are still that. You have a very long... You sent me your resume, and it's like 10 pages, Dr. Mike, so if I were to read the whole thing, it's very impressive, but I don't have time to read everything. But I reached out to you because we worked on a project ages ago, a music project, and, it was the first time I worked on a music project with a very respected cardiologist and surgeon, and it was an interesting experience, and you do great support of music, as well as putting yourself on the front lines there as a surgeon and cardiologist in Long Beach, and you've been posting some amazing posts, and that's why I started reading what you were posting, and I felt your information was so important to share with people. A couple of questions I wanted to ask you. One was you did a post just recently, I think it was last night, about people not understanding about the way this virus works and comparing it to what happened in 1918 about the waves and the way that isn't just coming and going, but in 1980 this virus came back a second time, and even they thought partially a third time. Is that right?
That's correct.
And
yes, indeed.
We need to learn, right? So maybe you can share. I mean, because your post was so eloquently written. I mean, maybe you can share what you were sharing with your Facebook friends.
Well, Cindy, this virus is a lot more aggressive than any of the viruses that we have known in our lifetime. This one is causing much more pathology, especially in the lungs, and people are dying at a higher percentage than just the common flu, if you will. And the hospitals, and especially the respiratory units, have been devastated. And as you can see, there's we're still on the upswing as far as deaths. We still haven't quite reached the peak, though it looks like we're getting there. And be that as it may, when we make comparisons with this virus with what happened back in 1918, at that time you had 50 to 100 million people that died from the Spanish flu. And interestingly enough, it came in three waves. And the first wave was in 1918, and people at that time did the isolation technique. But then the war ended, World War I, and people went out and celebrated, and they got together and everything. And within weeks, Wave 2 came around, and actually more people died in Wave 2 than did in all of World War I. Wow. And so, so that's what we're looking at right now is, what can we learn from history? We know that, this is going to get to the point, hopefully soon, when things are going to taper down, but it's not going to go away completely. You're not going to have the herd immunity, as they call it, amongst everybody. And so there's going to be the tendency now to people to get out of isolation, something that we haven't seen in our lifetime. And, people are tired of it. They want to go out. They want to enjoy life again. And you're going to see that this is going to bump up. And the question is, how much is it going to go up? Mm-hmm. And people just have to learn to be vigilant and not blow this off, which is what's happening to some people.
Yep.
And they don't see the microbe, and so they don't think it's there, but it's there.
Well, you're so right, and it drives me a little crazy because, I've heard people who don't even know if they had it thinking, I think I had something maybe like that back in January, so I'm probably immune. I've actually heard someone say that today. I think I got this before, and it sounded like it might have been it, so I don't think I have to worry, And it's like, you're a smart person. You don't even know if you had it, and you don't know if that was the case, and there's no way to test for that unless you get the antibody test. Let's talk about the antibody test, and I think you're ahead of the curve, much more ahead of the curve than we are here on Maui, as far as trying to find out if people do have antibodies. How does that work, and how do you see that happening in California?
Well, many of us actually question whether we've been exposed and whether we had a milder form, including myself and members of my family. And so we all kind of hope that maybe we did have it, mm-hmm. and maybe it was, and now we're immune. And so about a week ago, I went and I had the antibody test, and they checked for two things. One is called the IgG, which means whether you've been exposed to it sometime in the past, and the IgM is more of whether you've been exposed to it very, very recently, within a week or two. And unfortunately, in both cases, my test was normal, and so it told me that I had not been exposed. And other people that I have sent for these exams all turn out normal. And they think that they have maybe the virus, but it's probably something else. And there are other viruses going around. This isn't the only thing out there, but people think that maybe this is what they had, but it's turning out, and all the people that I've met at least, that wasn't what they had.
Thank you for that. I really we're still at the point where we're trying to get more tests. We're kind of ramping up, and unfortunately, again, being here in Hawaii, we don't get as much attention as some of the other bigger states, obviously. But as we're starting to get more tests, of course, like anyone and anywhere, we're starting to see more people testing positive, about the same percentage you've probably seen in other places, except for the situation we had with my memorial where there was someone ill that came back from a trip, and then a lot of people, unfortunately, in a cluster there did also get ill. You posted something recently, I think a few days ago, about the procedure of what you have to go through and the care of your protection that blew me away when I read and saw what you're going through when you actually suit up there. Can you explain to people, because just to let people know how serious this is, as a doctor, you're on the front line, you're putting your life on line, but what do you have to go through when you are going to work?
First of all, just walking into the hospital, you're stopped at the door, and there are nurses there, and what they do is they have a series of questions that they ask you, including, do you have a fever, do you have a cough, do you have a sore throat? And after you answer these questions, hopefully with a no, they also check your temperature, and if it's under 100 degrees, then they allow you to proceed, but they give you a mask and they give you a couple gloves. And when you go up to the COVID units where the people are infected, it's an interesting ritual that you have to go through. You have to be covered as well as possible. So you start off and you put a hairnet over your head, and then you put a cap over your head. And then what they do is they have you fitted for an N95 mask, which is that very special mask. And so you put that on and make sure that when you breathe into it that it doesn't fog up your glasses. Then they give you either a face shield or they give you goggles. And then what they do is they put gloves on you, and then they put a bunny suit over you, and then they cut a little hole near the end of the sleeve so that you can put your thumbs through there, so that it keeps the bunny suit so the sleeves don't get pulled up. Then they give you another set of gloves that you put over that, and then you put your cell phone in a plastic bag, and then basically I think you're ready. And so you go into the unit, and it takes a while. Obviously, there's people helping you doing all this. And I'm sorry, you also put booties on your shoes. When you come out is especially a difficult ritual because you have to remove everything systematically. And the difficult part is when you go into the unit, there's a little room that they've created right there. You can go through the room easily to get into the unit, but when you're coming out, you have to stop in that room, and there's somebody from the outside who's supervising you and telling you, you remove your cap first, then you remove your hairnet, then you have to remove your gloves, then you have to take a wipe and clean your glasses, then you have to take your goggles and put them to the side, then you have to sanitize your hand and remove, they go through this whole ritual, and the ritual takes about 5 minutes, by the time you've actually removed everything and thrown it and disposed it. And what's difficult is that if somebody is there already and you're trying to get out or trying to get into the unit, you have to wait for this person to go through this. Wow. And the funny thing was a couple of days ago we had someone from the cleaning crew, and the cleaning people are just tremendous in what they have to go through. Yeah. And they had all the garbage and all this and that, and we waited 10 minutes for this person to go through their ritual, to wipe down the garbage, their carts, the this, the that, before we could actually enter the unit. And so it's people are being very, very careful, and you need to be, because these are microbes. You don't know where they're going if you're just carrying them out. Maybe if they're in your hair, maybe if they're in your shoes, you don't know.
Yeah. And so when you go home, do you take your clothes off and wash them, or I mean, you're obviously, this is a pretty thorough protection plan. So do you feel safe
Well,
when you go
my
home?
wife is listening right now, and she has demanded I go through a ritual. So basically, I enter the door, and there's a chair right there, and I basically have to take everything off, and then I have special slippers, and I walk to the bathroom downstairs. I have a place where I dispose all my clothes, a sealed bag, and then I take a shower, and then I take clean wipes and I wipe everything down, including my cell phone, my keys, my this and that,
Wow.
including the chair that I just sat in, including the door, and then I put on some new clothes, and I go through this ritual, and now I have to sleep in a separate room.
Wow.
And so, not because I've been a bad guy, but because, we're trying to keep it as clean as we can. And so this is something that a lot of healthcare professionals are doing right now.
And this breaks my heart, because you're putting yourself and going through all of this and putting yourself still at risk. Have you seen situations in your hospital, because obviously your hospital and you're part of the team there at Long Beach Memorial, are you seeing people feeling safe with this protocol, and have you seen any breakouts with the nurses and doctors there or personnel?
Not yet. Not at our hospital, in Long Beach Memorial. We haven't seen any amongst our personnel. Thank God, we've been able to institute some very strict procedures. But, thank God we have the equipment, too, because the equipment in other parts of the country may not be as readily available, and they became more inundated and they ran out of the equipment that they had, and so they made themselves a little bit more vulnerable.
What do you think that is the thing that, obviously you've learned to respect how pervasive this microbe and this virus is? What would you tell to people who still don't get it? The people out there that aren't taking it seriously. What would you take from your experience of what you're seeing in this COVID-19 situation that you're in at the hospital?
Because you can't see something, it's a shame. It's like high blood pressure. You can't feel it, so people leave it untreated. It's the same thing with this virus. This virus can be anywhere. It can be in any room. It could be just floating in the air, and not just for a few seconds, but for minutes and maybe hours. It can survive on different surfaces for days. And so, the thing is, you have to be vigilant. You have to be smart about this, because you don't know if you're going to be the one who's going to develop this problem.
Yeah.
And it can attack anybody. I mean, there's so many people out there who think that they're macho, and they think that, it's not going to happen to me, and if it does, I'm not going to get, I'm not going to get a bad effect. And yet you see infants dying, you see young people dying, and, and when it shouldn't be, and so, don't think that, you're going to be spared. Statistically, you will be. The chance that you're going to be the one who dies is going to be on the lower end of the spectrum, but that doesn't mean that you're not going to be the one who dies. And that can happen to anyone, and you don't know what you're carrying to other people. A lot of young people, who tend to, not be afraid, they don't know if they're bringing this to older people, older relatives, or other people, and so you have to do it, at least, if not for you, you have to do it for them.
Absolutely. And it is hard when you have a family, you have a wife, you have people that you love, there's got to be a very high stress level. There's got to be a high stress level for you, the workers, the nurses, the personnel, the families. They're going through a lot of stress. Is anything that you do to try to keep your morale up and not to get too stressed out?
Just read as much as I can and try to understand this as best we can. One of the concerns, obviously, is what can you do to prevent it? What can you do once you get it?
Yeah.
And we really feel that there's some things that can put you ahead of the curve. And we advocate using vitamin C, but especially zinc. And we found that zinc, what it does is it makes it a little bit more difficult for the virus to replicate in the cells and to, bring its, DNA in there and cause and wreak havoc. And so we recommend that people take zinc at least 30 to 40 milligrams a day, vitamin C at least 500 to 1,000 milligrams per day. And so, that I think everybody should be doing. And then, when it comes to treatment, once you develop this illness, then you're at the mercy of whether this illness wants to progress or not into something that causes damage to your lungs. And there's treatments out there that are unfortunately in trial, and there's a lot of promise. There's one thing, remdesivir in particular, that's made by Gilead, and then there's a new medicine that is made by the Japanese. And these are in trials, and they're showing promise. Not that necessarily they give you a 100% cure, but they're looking at about a 70% cure if you get severely infected and you're in dire straits. So there may be something there, but again, it's a trial, and so it's going to take time before it gets approved and is readily available. So you want to make sure you don't get anything now.
Well, Dr. Mike, and should I try to pronounce your last name? Oh, you got to help me out here.
Vasilomanolakis.
Vasilomanolakis. Lakis.
Thank you, Cindy.
Thank you. I love you, and I love what you're doing, and God bless you and keep you well and protected. And I thank you so much for taking the time in your busy schedule to call in and give us your wise information.
Oh, it's my pleasure, Cindy, and I admire you for everything you're doing. You're the best.
Thank you. We'll be in touch, and aloha. Stay well.
Aloha.
Aloha.
Bye-bye.
Bye.